free America. So I just retitled this, Pipe Dream or Reality. But the conditions to make regulatory science more a reality than a pipe dream. So I think we've heard these themes sort of already articulated. We need to prioritize what we're focused on. We need to delegate tasks, not just leave it to the FDA, but this is a shared responsibility for all groups. And we need to have accountability for every group who's a partner or stakeholder in this process. So we go back to 1964. Luther Terry laid out in the initial Surgeon General's report, why we're focused on this topic. And as we heard earlier today, Robert Kennedy talking about the charge really to the public health and medical community as to what we were dealing with. The cigarette industry is peddling a deadly weapon. It's dealing with people's lives for financial gain. And he concluded by saying we must act and act now. I think those are words that we really need to focus on. In fact, in his speech, he talked about three things. So it's almost like revisiting what now 44 years later after the speech was given, the charges that he laid out. He said, what can be done to discourage young people from beginning to smoke? What can be done to encourage those who already smoke to break their habit? And what can be done to make cigarettes less harmful? Actually in 1964, right after the Surgeon General's report was issued, they talked about smoking and end an era. What's going to happen now? And the things that they talked about then are the things that we've been doing essentially and continue to talk about doing over the last almost 50-year period. So, how far have we really come? I guess might be one thing. Robert Kennedy in his talk in 1967 at the First World Conference talked about each new effort to regulate will bring new ways to evade. Still, we must be equal to the task, and the stakes are nothing less than the lives and health of millions all over the world. And of course, the industry responded right after the Surgeon General's report. This is a memo from Weissman to Coleman at Philip Morris and said, we're going to change. We must in the near future provide, some answers which will give smokers a psychological crutch and a self-rationale to continue to smoke. And, they did that through a variety of ways. They tried to, provide information that, would help clarify the facts to consumers out there. And, of course, they created doubt and gave consumers a false sense of security, as we know, through the low tar and filtered cigarettes. And, in fact, 5 days before the first Surgeon General's report was issued, Brown and Williams had, introduced the first filter-vented cigarette, so preempting the Surgeon General's report with the concept of somehow a low-tar cigarette. And we've removed light and low-tar labels, but the filter vents are still there, and that's really the fraud. They changed behavior. They focus on behavior. That should be our focus, the behavior of kids starting to smoke and the behavior of adults trying to get off of cigarettes, because most would prefer to get off of cigarettes anyway. And the introduction of filters and low tars really dominated the health statistics. You can go fast forward. We've had strong leadership from Robert Kennedy, who laid out, he said, we must act now. Basically you go fast forward to C. Everett Koop, and he laid out the charge for a smoke-free society in 1984. And he said, we publish these reports, and it's great, and we celebrate them, but really, there has to be more pressure, the publication of the reports and so on. There has to be more pressure to our efforts than that, purpose to our efforts than that. I believe we need to ask ourselves, what our objective is down the road. And he laid it out. He said, we should have a smoke-free society by the year 2000. And we can go fast forward. And we're making progress. And we've seen some of the statistics from Gary earlier today. But we didn't make it at 2000. And what is our goal today? We are bending down the curve. Cigarette consumption is going down. Lung cancer rates are falling. The public is behind us. But we still have a long way to go. Finally, we got the FDA authority to regulate tobacco. That's why we're here 2 years ago. Now we're looking back 2 years to see how things have gone. What can the FDA regulation of tobacco really accomplish? The FDA can't solve tobacco problem by itself, but it can make a huge difference if they adopt 4 guiding principles. be nice to see these principles articulated verbally. I don't really see that we have leaders like we did in the past articulating these so the public knows what we're all about here. Focus resources and regulatory efforts on the product that causes the most disease. So we've had a lot of discussion about smokeless and dissolvables and electronic cigarettes, but I don't hear as much about Camels and Newports and Marlboros out there, and that's what's killing most people. Concentrate on regulations that have the potential to change how people use cigarettes by reducing the addiction liability. We've heard discussion about that, and making it easier for smokers to get help to stop smoking. And while I enjoyed Jack's talk and all the tests that can be applied to abuse liability, we know who's an addicted smoker. Those who are persistent daily users, those are the people that have trouble quitting smoking. And we can measure that in population surveys, and I think about 85% or so of smokers are persistent daily users of the product, a huge high abuse liability. And we can use that as a metric. We ought to flip that around and make it like it is for like alcohol, where we have 15% abuse liability, and we would dramatically change the risks that we see from cigarettes. Make it a priority that consumers are fully informed about risks. Monitoring consumer beliefs and behavior, strengthening product warnings is needed, and conducting public education about those risks. Those are all things that FDA has in their authority to do. And move quickly and decisively to end clearly deceptive marketing of cigarettes by, how about banning filters? They don't do anything. It's a device on a product that has no benefit whatsoever. Except it does encourage young people to think cigarettes are more acceptable, because I can't find any kids willing to take up unfiltered cigarettes today. And it's also a litter problem as well. Restrict, and if the companies want to put a filter on, then they should prove that it works. Restricting the locations of where cigarettes can be sold, requiring companies to provide convincing evidence that their product marketing is not misleading to consumers. So there's a lot of good that we've seen with the FDA. We've talked a lot about this today. Stronger pack warnings, ban on deceptive marketing descriptors, a population health standard. Those are all good. We see we're a little late to the game with product warnings. So as I've been saying, we've been a third world nation when it comes to educating our population about the risks of smoking. We're catching up with the warnings. I think that's helpful. We can be a little stronger and learn from what's been going on in other countries. We've gotten rid of the light, mild descriptors. Although, in my CVS, the drugstore that's still selling cigarettes along with the stop smoking medications, I came across these a couple of weeks ago where you can see the Marlboro lights that are still on the top. They said they have a rogue, Philip Morris salesman who likes to make sure you know what the different colors are below. But apparently somebody didn't get the memo about the law. So perhaps someday we're going to see, FDA order pharmacies to stop selling tobacco and maybe get the convenience stores out of the business as well. How about some health warnings to be posted at point of sale? While we heard about New York City doing this, which is a great idea, they've also ended up in court thanks to Philip Morris, who didn't like those health warnings to be posted at the point of sale. But FDA could do that tomorrow as part of their rollout of the warnings and make sure the quit line number is there, just like they do in Australia. FDA regulations so far, well, there's some bad parts to it as well. There are many loopholes, built-in unnecessary delays. Give an inch, buy a decade. That's always been their motto. Delay, delay, delay. So FDA authority happens, and we go right to the courtroom and so on. And, we spend our time sort of going after some distracting things like deadly e-cigarettes are seized. I don't want to get into the debate about, e-cigarettes and so on, but it is the Marlboros that's the problem. So this is sort of a distracting lawsuit, unfortunately, and we need to keep the public focused on what the problem is, which is cigarettes. And of course, there's the ugly part of it too, because the law, while it was great, had some limits as well, such as restricting marketing, prohibiting, banning a class of products like cigarettes, and cannot completely remove the nicotine. So we continue to see marketing in I think, fairly aggressive ways, like on Facebook and so on. This is the spring tour for American Spirit, by the way. It's not Santa Fe Tobacco. It is R.J. Reynolds Tobacco. And they've been out doing their spring and summer concert series and so on. You can go right on their website. They have a whole array of new products. We've seen how those are burying the FDA under their guidance here on substantial equivalence. I'm not going to go into this because Greg has already talked about it, but the industry is already talking about their influence is likely to grow under FDA rules, and we need to stay focused on making sure that does not happen. We have these sort of new products that are out there. Maybe they're good, maybe they're bad in terms of addressing it. I don't think we know the answer yet, and we should before we allow these products to come on the market. I think that's pretty clear. So you see a lot of this kind of thing going on, and I don't know if the sound is on, maybe not, because this is one of the ones we're going to see sound. But with the new designer labels here, you can see the UPC codes, by the way. You can see the little logos. These are new on the UPC codes, which is quite interesting. Let's see if I can get the sound to go here. Nope, I guess not. All right, we'll move on. We have cigarettes. What would you have heard? We did some focus groups with teenagers, and we asked them about the dissolvables and so on about a week ago. And what those teenagers would tell you, they love these products, not because they would use them that much, but you can get away with these products in school and nobody will know you're using them. So it is a way to escape detection, unlike cigarettes and chew and so on. That's what the dissolvables seem to be of interest to, and they like the flavors to the products as well. And young girls, by the way, when we ask them about looking at the smokeless tobacco products versus cigarettes, the young girl that we interviewed, the focus groups with the young girls, they basically said they would never put this disgusting smokeless tobacco in their mouth, and they'd rather burn up their lungs than have the junk in their mouth. So I think that tells you that we're going to have a little trouble if we're doing this as a harm reduction strategy, at least with young girls out there. So what is our ultimate goal? Well, this is what Healthy People 2020 is talking about, and reducing illness, disability, and death related to tobacco use and secondhand smoke exposure. And the Surgeon General laid this out in his speech in 1984, where he talked about the need for delegating responsibility and partnership. And he talked about healthcare organizations, the media, the military, government. You can't do it alone. In fact, he said it shouldn't be the government alone. It's got to be all groups together as stakeholders in this goal. So what about the tobacco industry in this process? I think there has to be some accountability to the industry in this, and this is one of the ways that I think the FDA regulation can be brought into play. Cigarette manufacturers should be held accountable for reducing smoking prevalence. Why? Because the manufacturers themselves have much more control over cigarette prevalence than does government. The manufacturer controls the product, the price, the promotion, and the placement of those products. And so, if you alter the process here, and states could be doing this, some places like New Zealand, this is exactly what Richard had talked about in his visit to New Zealand, where they talked about these kinds of policies, such as pricing cigarettes to recoup healthcare costs, which would dramatically raise the price, or setting yearly quotas on cigarette sales, or perhaps indexing profits to the smoking prevalence. So we have a year 2010 objective, I think, of 12% for tobacco. That was the goal that the government set. We didn't quite get there, and so we just updated that goal. We didn't change the prevalence. So from 2010 at 12%, we went to 2020 at 12%. So we got another 10 years to get to the same goal that we had set, a decade ago. That doesn't suggest that we're making very much progress, and there's not a lot of accountability to that. So why not hold the cigarette manufacturers responsible for ratcheting down the prevalence and charge an excess profit tax on their profits, basically, if we don't make the strategy. So what does the 2020 objectives talk about? Well, they talk about essentially the same things that the Consumer Reports did in 1964. Fully funded programs, increasing the price of cigarettes, controlling access, and so on and so forth. All good things, but maybe not enough. And in fact, even under optimistic assumptions, these actions won't be enough to really lower smoking rates. This is from Ken Warner. And we saw Gary do some estimating as well. And so we've got to come up with a new strategy. We need some new ideas. So how about the Department of Homeland Security recommending a national tax collection system on tobacco products so we can curb the growing illicit tobacco trade that's going on in our country and is likely to grow under FDA regulations, by the way. So a nationalized system so you can track and trade, track and trace the distribution of the products, which is a real problem between our states at this point. Or like New Zealand and now Finland, they've actually introduced bills to essentially talk about phasing out the most dangerous products, cigarettes, over about a 20-year period. So tobacco sales ban proposed where they're going to eliminate the sale in various venues over the next 20 years. We need an agreed upon measurable goal. I haven't really seen this talked about. So reduce cigarette smoking prevalence rates by a modest 1 percentage point every year among children and adults. If we did that where we are today, we'd almost be phasing out cigarette use among adults within the next 20 years, and by 2020, we'd have the smoking rates among children pretty much eliminated. So resulting in a gradual phasing out of cigarette use by children over about the next 10 years in 2030. You know what? There'd be a lot of public support if we just come out and articulate a clear and measurable goal and make sure everything that we do is focused on achieving that goal. So strong government action we know can make a difference. We've seen it at the local and the state level. Confluence of clean indoor air tax increases, media campaigns, free NRT. You know, it's had an effect in New York City and California where they've been doing this a lot longer. We've seen a dramatic change and so on, despite the fact that the government hasn't always acted in its best interest because they've gone in to try to reduce the program over time. But still, even with that, you can see in California they're bending back the curve on lung cancer rates a lot faster than they are in the rest of the U.S. But government action alone won't solve that our problem. So there are some summary points. I think we need to prioritize what is important to achieve. We need some leadership on this issue, and the priority ought to be to establish a single, measurable objective to reduce cigarette smoking prevalence by 1% a year. We need to delegate tasks. FDA can't do it alone. I think we've heard that repeatedly. A national strategic plan would help. They have it in a lot of countries. I haven't seen one issued. I understand one is under development, which would be welcome to see. Responsible parties need to be held accountable. So government agencies can't just come out with an objective that they didn't meet and restate it 10 years down the line. They've got to meet their targets. Health voluntaries and the tobacco industry need to be held accountable for their end of the business. So we're making progress, you know, but we seem to be lacking the urgency that was in that message from Robert Kennedy in 1967. We need to act now, and we need to be acting a little bit more forcefully than we are. So I always like this slide because it says, you know, March 1, 2010, you know, the last American smoker. Well, we didn't quite get there, so maybe we should just change that to 2030. So thanks very much.